welcome back to We Help You Home. This is the podcast where we help seniors and their caregivers discover the best ways to age well at home and find the support they need along the way. I'm your host, Rob Steinbrook, and today we have a special and meaningful conversation scheduled for you. It's one that honors the men and women who have served our country. We're talking about the We Honor Veterans program. My guest today is Maureen Kelleher. Maureen has experience in veteran-centric end-of-life care and has helped many organizations understand how to better serve veterans through the We Honor Veterans initiative. Here at ATEX Home Health and Hospice, we're proud to be a Level 1 partner in this program, and we're currently working on Level 2. So we wanted to take some time to educate our listeners about what that means and why it matters. Maureen, welcome to We Help You Home.
Thank you. Happy to be here with you.
So let's get started with the basics today. Maureen, can you tell us a little bit about yourself and how you became involved in educating others about veteran care?
Sure. To start with, I am a registered nurse by background, and I have my MBA in healthcare administration. I became a nurse because of hospice care that my dad was provided and was actually hired straight out of nursing care by that same hospice. So my passion is hospice and palliative care. My dad, my brother, and an ex-husband are all veterans, so I have a little experience with the military itself. But as I worked my way up through the hospice world and came into leadership of the hospice programs, we honor veterans and we work through all the steps. And when I was running programs, there were only 4, and now there's 5 steps. So they're expanding even the program itself. And it makes such an amazing difference to the veterans that we provide care for at end of life. When you work through the steps, you get a closer connection with the veterans in your area. And it's just, as we go through what it is and what we do, it just kind of, I don't know, it really touches your heart when you see the relief and the smiles on the veterans' faces when they're acknowledged, when they're heard, when they're seen, when they're recognized.
Well, thank you for that. And for those that are hearing about this for the first time, what exactly is the We Honor Veterans program? Tell us who started it and what's its main goal.
Okay, so the National Hospice and Palliative Care Organization originally started the initiative working with the VA and some local VAs. And now the NHPCO is called the Alliance, the National Alliance for Care at Home. They have been working on this program for a very long time. I can remember it way back in the early 2000s, hearing about it even as an admission nurse or an inpatient unit nurse and what we were doing with veterans. But it was created in order to promote veteran-centric education, activities, increasing organizational capacity to serve veterans, supporting development of strategic partnerships with the VA, with the American Legions, with the VFW posts, with any of the military and veteran services that are in all the communities. And then more importantly is to increase access to improve quality of care to veterans at the end of life. And there are a lot of challenges for veterans, even in regular health care, but when they get to the end of their life, having hospice accessible to them and helping them get through that journey in our healthcare life is something that the national organization thought was very important. So it provides tiered recognition. They have, like I said, 5 levels now. The hospice programs are known as partners for veterans, and it demonstrates commitment to improving care for veterans. The 5 levels, like I said, when I was doing it, we got to level 4 and we were all happy. And then a few years later, they added level 5. Like, oh, okay, one more step. But it really is embedding end-of-life care, hospice and palliative care too, into the journey that veterans have and training our providers, our healthcare workers, on the nuances of a veteran. And those nuances change depending on when that veteran served and what they were exposed to.
And of course, we know that one of the key ideas behind this program is that veterans often have unique needs, both
Mhm.
physical and emotional. Um, some of these needs come from their time in military service. Can you share what some of those unique needs are and why specialized understanding makes such a difference?
Right. So, like I said, depending on when the veteran served, the Korean War, the Vietnam War, World War II, women vets, veterans of foreign militaries, which is something we don't often think about. We have a lot of people who live in this country who served in other countries' militaries, and they have unique needs. And then we have, unfortunately, homeless veterans who have even more specific needs. So some of the trauma, were they physically impacted? Were they mentally impacted? There's moral injury where they've seen things or done things under orders or as part of war to protect themselves and their troops, but after the war, it's going through your brain. Was that the right thing to do? And the conflict between their religious beliefs or spiritual beliefs and who they are as opposed to what they did. And then the camaraderie as more and more of their buddies, in the wars and in service, as more and more of them age and pass away, it's still that, what does this mean for me? And what is my legacy? And so it's a very unique position for men and women to be in at the end of life.
So let's talk about what the program actually provides for organizations like ours, but also for the veterans and families that we serve. If a hospice or home health agency joins We Honor Veterans, what kinds of training or resources does the program offer?
So each level has its own uniqueness to it and what it does. It starts out with level one, where you're looking at a military checklist. You're getting your team trained on how to ask the questions, how to actually approach asking somebody if they're a veteran, what service line they served in, and opening the door to conversations and questions, seeing if we've noticed there's a lot of veterans who may not even be aware they have veteran benefits. And so it's just getting the conversation starting. And we know that people save things forever in a day, right? So they'll have their DD 214 in a box somewhere with whatever else they accumulated during that time period. And they have to dig that out. They have to find that because that's proving they deserve the veteran benefits and what benefits they're eligible for. So we get that out, we have those conversations, and then we can use tools. There are depression tools, there's suicide tools, there are tools just to help get them signed up for benefits. Working with ombudsmen and who they can go to at the VA to make sure they're getting the right services. If they currently have health issues, are they accessing the VA for some of the services they could get there where they wouldn't necessarily have to pay for through their insurance, any co-pays or co-insurance if they were seeing a physician at the VA. Yeah, and again, VA hospitals and clinics aren't everywhere. Some places it's a
Yes.
long drive to get there. So understanding that in those cases, the VA will cover some of their healthcare services, even if they're not going to the VA. And there's TRICARE insurance and all the other things that come with the military who stayed and retired military, but it's different for those who were in 3 years, 6 years, didn't retire. Those benefits all change. So actually being able to provide those resources through NHPCO or the Alliance now, through your own veterans. The VA has ombudsmen that when I was running a hospice, we would be talking to them all the time. And some of them will only work with a few hospices. So in one situation, they only worked with 5 hospices, and you had to have specific quality metrics in order to be that one of their partners. So it's also then engaging your team in with the American Legion, with the VFW posts, getting into all of the other veteran community services so they know who you are, but it also helps us to learn when we sit down with people where they are. If you can get invited to some of the events, you can sit down one on one with people and talk to them about their experiences if they're willing to. And it teaches you so much as a lay person, so to speak, to learn about what they went through, what they learned, and getting people to open up. And they can also help your hospice program by volunteering for your hospice program and doing vet to vet communications when you do find that there's somebody who didn't know about what services were out there, or just having somebody from that same time frame to be able to talk to about the things they saw and did without fear of violating some kind of code that they feel they still have to lock all that in so they can actually experience and get through the emotions and come to some kind of reconciliation for themselves before they pass to the next realm or whatever they believe in.
Right. Yeah. There's a lot of benefits available that a lot of veterans just don't know about or they don't know how to access. And
Uh-huh.
so helping them on that journey it's a privilege, isn't it?
Yes.
Uh, and for veterans and their families, what difference do they see when they're cared for by a team that's part of a We Honor Veterans network?
Well, from personal experience, I can tell you that when you have a family member who is at their end of life and they served in the military, whether they've been through the Vietnam War and the Korean War. So the Vietnam War was a very negative response when they came home from the American people. The Korean War is what they're calling the forgotten war because a lot of people didn't even know it was happening. Then they didn't even know that we sent soldiers over to Korea. And when you can partner with a veteran community service, and in hospice, we did pinning services. So we'd get a little flag pin, give them a certificate, thanking them for their service. But the first time you see that person actually hear that they've been heard and that they've been recognized, I can't tell you how many times I've been in tears at these pinning ceremonies, whether it was my dad or whether it was somebody I knew or whether it was a patient of ours. It didn't matter. You see, there's a change in it's the aura, so to speak, of that person. They relax. There's a smile on their face. There's tears in their eyes if they're not outright crying. And it's as if they waited all their life just for someone to say thank you, and they never heard it heartfelt. And when you have other members, especially active duty members or vets, come and be a part of that pinning ceremony, they know that there's people in the room who understand where they are. And I don't know, you can't really describe it, but what we get back from the families is, I am so happy that you did this because I have never seen him not stressed, and we could never figure out what was causing that stressful look on their face. We couldn't the tightness, the not wanting to talk about anything and being so afraid to open up, and you just see the relaxation. And it doesn't happen with everybody, but it happens with a good number of people. And it is that acknowledgement, that being seen. We all want to be seen, but when you're a veteran, there's a whole other side to that that you've been holding in and keeping to yourself. And the family then is able to open up more lines of communication and get some more resolutions before the patient passes away. So that's my experience with the programs in several different hospices that I've run or been a part of, worked for.
That's this is so important to help them know they are appreciated and that they're seen and they're heard, and it does make such a difference in their lives. And I love that this program is structured around different levels, or what the program calls stars. Can you explain what those levels mean and what it looks like to move from level 1 to 2 to beyond?
Sure. So let's see. So level one, like I said, is the entry level. You get in there and you say, this is what we want to do and how you're going to start doing it. Mainly, you're going to build in the military checklist into your admission process. And you're going to teach your nurses, your social workers, and your spiritual care counselors how to approach the questions and get the answers that you need. It's more education on your staff and trying to identify community partners. You get into level two, and it's more building an organizational capacity to provide quality care for veterans. So now you're actually going out and finding what are the needs in your community? What kind of veterans do you have in your area? Are you are you capturing them on admission so that you can start having these conversations early? And where are your partners in your community? Do you have an American Legion? Do you have a VFW? And I know I'm missing a whole bunch of other acronyms that are out there, but and if you do have a VA hospital, getting in touch with the ombudsman, that's probably your most important connection if you have a hospital, a VA hospital. And then when you get to level three, it's developing and strengthening those relationships with that medical center, with those organizations. So now you're going out and you're doing presentations about end of life care with these different veterans organizations. You're inviting them to pinning ceremonies. You're asking if you can get volunteers from their groups. And it's really amazing how many of those veterans are willing to volunteer when it comes to this. They understand, they know where they're coming from. Level four gets even more deeply into the quality of care for veterans in your community. So now you're working with other healthcare providers in your community. You're working still with the VA and the veterans organizations. It's more of a deeper dive into access, into early referrals, into making sure that people know even before it comes to this that they have veteran or VA benefits that they are not using. So we want to make sure they know they are entitled to care. They know they're entitled to VA benefits, and that they understand that end of life care, hospice care, is a benefit they get not only through Medicare or their insurance if they're under 65 and not on disability, and through the VA, which offers them so much more help, even to the point of having a few hours of private duty come in. So it's that education of the community and the healthcare community as well. And then level five, and I will say that I did not ever have to do level five because I kind of went into consulting before that, but expanding partnerships with other organizations in your community. So it's working with other hospice programs, working with home health programs, having them share their knowledge with you and you share your knowledge with them on what has worked or not worked, mentoring people to be more involved in veterans affairs and understanding the unique care that's needed for veterans towards the end of life. So that's kind of it in a nutshell. It's not deeply diving into it, but as you know, as you're approaching your levels, there's a lot of the checklists to go through.
Yes, yeah. No, I appreciate the overview as well. And there's so much available that companies can do and that people can do to partner with the veterans groups as well. Here at ATEX, we're just starting our journey, really, and we've achieved level one and we're close to getting our level two accomplished. It's really been eye-opening to learn how much goes into doing this and doing it right when you're trying to when you're trying to get these levels accomplished. I appreciate you being on today. We're going to pause for just a moment and take a quick break, and we'll continue this conversation in about 30 seconds.
At ATEX Home Health and Hospice, we believe home is where healing and comfort truly happen. Our team proudly serves families across San Antonio, Austin, Corpus Christi, and the Rio Grande Valley. We offer compassionate care that helps loved ones stay right where they belong, at home. To contact us or to learn more about our home health and hospice services, visit atexhealth.com. That's ATEX health.com.
Welcome back, Maureen. This has been a great conversation. You've worked with many organizations who have gone through the We Honor Veterans program. What kind of impact have you seen both for the veterans themselves and for the staff that are providing care?
Well, and as we discussed a little earlier, the emotional benefits for both the caregivers and the veterans themselves and their families. Outside of that, it's making sure that the veterans have the care they need. So if they have the VA benefits and they can get some care, a private duty caregiver to come into the house and relieve their spouse or their daughter or their son who's helping take care of them for an hour or so or whatever they're allotted, to make sure that they're seeing the right kind of providers for whatever it is that's their health issue is, whether it's oncology or cardiology or pulmonology, that they're seeing the right providers, that they're getting the right tests. And when you combine the VA benefits with other insurance benefits, there's a better opportunity maybe to be able to afford those tests. Whereas if you're having a lot of out-of-pocket expenses, that the VA might cover those, you want them to know that so they can get the tests and the treatments that they need. So they have the opportunities before they just give up because they can't afford it. The other side of that is for the homeless vets, trying to get them off the streets, trying to make sure they're getting help. If there's drug addiction or alcoholism involved, getting them into programs that can help with them with that to improve their health overall, but also to help them each get what they need in this life to improve the quality of their life. And it's just when you see somebody get the help they need and when you see a positive outcome from it and it improves their quality of life as a caregiver, it it actually makes you feel like you've done your job. And if you find out too late that somebody had all these benefits and didn't know and you could have done something about it, then you feel like you failed your patients and their families and your community. So it really is making sure people have, and overall, hospice is the goal is to make sure people have the kind of care they need, right? It's that their symptoms are managed and that they have a peaceful and comfortable journey at the end of life. For the veterans, it's understanding the nuances, the PTSD, the mental challenges, the spiritual challenges that come into play. And hospice has always dealt with emotional and spiritual challenges. I just don't think that 30, 40 years ago we understood how deep those can go with for veterans and their families.
Yeah, that's really powerful, and it reminds me that honoring someone's service, it isn't just about a ceremony. It's really about providing holistic care for that person.
Right.
Uh, Sometimes that means asking questions like, "Tell me about your time in service," or "What branch did you serve in?" Just small gestures to really open doors where you can make a connection, as you touched on even earlier.
Yeah, and I would say that it's when you work with veterans organizations, when your hospice works with veterans organizations and you get those volunteers to help, it is easier, as we talked about before, for a vet to talk to another vet. So
Yeah.
the question of tell me about your time in service is going to be easier received if it's coming from another veteran as opposed to someone who's not been there. And that's with most trauma. If you haven't experienced it yourself, it is difficult to understand what that person is going through. And even if your situations are different, if you've been through trauma of some sort and it's similar, then another person who's gone through trauma will understand on some level. And it does make it easier to talk about. If you're talking to somebody who's never experienced it, never had anybody in the military, even peaceful times in the military, if you've never experienced what that's like to be the family member at home while they're out to sea or in another country and you don't know if they're coming home, yeah, that's why they have ombudsmen. That's why they have spouse groups and organizations when you're active duty, so that the people who are still home have people who are going through it that they can talk to. And then it seems like they come home, they get out of the service, and we forget that they still need a connection. And so that's what this program hopes to do. And as you move through your levels and you get to level 5, working with your entire community, the healthcare community, the spiritual community, the veterans community, helps make that happen a lot sooner than at the end of life.
From a bigger picture standpoint, why do you think focusing on veterans at the end of life is so important for our country right now?
I think there's a lot of focus on the veterans overall. I think the homeless veteran situation has brought a lot of focus to veterans. But I also think there's changes in our military. Sometimes the recruitment levels are down, and there's, you know, the changes in the organization, who's leading it, who's in charge of it, what are they doing, and when we look back on history and we look back at the challenges of Korea and Vietnam and the Persian Gulf and all of those wars, and it's that question that we always ask: why were we there? Was it worth people's lives? And if you were a veteran in that, can I live with the moral objections or with the moral turmoil that may have led to? And again, not everybody will experience it the same way, but some people will have more difficulty once they get back into civilian world and more challenges. And then if you also add in physical injuries, so loss of a limb or a brain injury, there's so much more behind all of that. And brain injuries, traumatic brain injuries itself, the brain can sometimes get stuck in a cycle of remembering as if it's happening over and over and over again. And I think there's been a lot of attention to PTSD lately, over the last 10 to 20 years, I think. And I think that was kind of eye-opening for the hospice world, is that we're getting these patients who haven't dealt with things for 10, 20, 30, 40, 50 years. And now they're at the end of life and it's becoming a crisis.
Yeah, thanks so much for that insight, Maureen. Really appreciate that. Let's talk about how people and organizations can get involved. If someone listening works for a hospice or a home health or a senior care organization that isn't part of We Honor Veterans yet, what are the steps to join?
So the first thing they do is they look up the We Honor Veterans website that is on the Alliance website. So you can get it either just typing in We Honor Veterans or Alliance, and it will take you to the We Honor Veterans section. And then there's an application you fill out. And the resources that you want to start looking at is the military history checklist that they have. It's designed to help you ask the questions. The military checklist informational sheet, which is what you can use to provide education to your staff. And then there's a guide as well, so some ideas and tips on how to approach a person when you're asking them about their history. And they also provide resources on the actual partnership, the Hospice Veteran Partnership Toolkit. They have communication tip sheets, and then they have hospice and VA working together relationship building tools. So they pretty much provide you with everything you need. You then take what they give you and you figure out how to implement it into your day-to-day activities. So starting with the military checklist, you can talk to your EMR vendor and see if they can build it in as a form into your actual EMR, into your assessment notes. Or you do it on paper like everybody else does and just make sure that it gets scanned into the EMR. You also want to provide that education to your team about the different kinds of veterans and the issues. What are their issues at the end of life? Understanding the benefits. It's really important to at least have a basic understanding. You don't have to know how to get them, specifically how to get them their benefits, but you do have to understand what benefits are out there. Understanding the Department of Veterans Affairs, having those resources, those contact numbers to provide, building that veteran-centric culture. So, who's going to be involved in this? Are you going to have a special group working with veterans? Are you going to train everybody in your organization? there's a lot of challenges as far as who's comfortable with it too. And then just having a homeless veterans end of life program. I know in one of our programs, one of the hospices I worked for in the Northern Virginia area, we would reach out to like Catholic Charities and to the Jewish Foundation or the temples and some of their services, the Jewish counseling services. And if we had homeless patients, we would work with them that the veteran could come to, say, Catholic Charities office. We would have their medications delivered there. They could pick up their medications. The nurse could meet them there and do their assessment. And then we could work with them and the social workers on trying to find them some housing. At the time, Washington, D.C. was very fortunate to have a home that was dedicated to homeless veterans at end of life, and there was a place they could go. It's been a while since I've been back in that area, so my understanding is that doesn't exist anymore, but I hope I'm wrong. I'm hoping that there are other options for them. And then wounded warriors, understanding what that means, understanding what moral injury and distress from that means, and that's that whole question of what did I do and can I live with what was done and what did I see and how does that impact my moral values? And so that's level one. And you start there and you get there and then you move into level two, which, like we said, is where you are. And it kind of expands level two into doing more basic training, doing more connections, community-based connections, education, and getting more in alignment with veteran organizations and community. And it kind of just builds, what each step does is it builds it out into a bigger healthcare, veteran, community program.
And for the veterans and family members that are listening today, how can they find out if their care provider participates in this program?
Well, for hospice, it's easy. You go to the hospice website, and usually they have the We Honor Veterans logo at the bottom of their website with the number of stars. So you can tell where each one is. And that was always one of the things. Every time we'd add another star, we could change our logo. And it was like, we're making progress. The other way is just to call the hospice programs. If you're already getting veteran benefits, you can check with the VA in your area, and they can tell you what hospices and programs they work with. And if the hospice has a really good connection with the veteran organizations, they can go to their posts or to their groups, and they should have information about end-of-life care and what hospices they're working with.
That's great advice, Maureen. Thank you so much for sharing that. We're going to link the We Honor Veterans website in our show notes. And the website, of course, is wehonorveterans.org. Before we wrap up today, I just want to share that at ATEX Home Health and Hospice, we're proud to be part of this national movement. We've already started implementing veteran-specific practices like screening every new patient to see if they've served. And our goal is to move from level 1 to level 2 here soon this year, and to keep growing from there. We believe our veterans deserve the very best care, compassion, and honor. Maureen, thank you so much for joining us today and for sharing your heart and knowledge about this important program.
Well, thank you for having me, and it's been an honor to talk with you about this. It's very exciting that you're doing this. I'm happy to hear that this program is still expanding and growing and getting out into more and more communities. It really will make a difference, and your team will be very proud as you go through each step.
Thank you so much for that. And to our listeners today, thank you for tuning in to another episode of We Help You Home. If you found this episode helpful, please share it with a friend, caregiver, or a veteran, or someone who supports a veteran. And don't forget to subscribe so that you never miss an episode. Until next time, I'm Rob Steinbrook, reminding you to take care of yourself, take care of your loved ones, and always honor those who served. Thank you.